Sure. Thanks, Nick. And this one, it's early days, even earlier than the ones presented already. So some of this is just speculative, just sort of saying this is what we're intending to do this year. And it's been long-standing. We've been wanting to do this for a while. But essentially, we want to make sure that we can capture and spotlight the co-benefits, that when we do these NCD and mental health interventions, we know we're getting improved health outcomes on communicable diseases and well. And between us, there's still, such a massive architecture of infectious disease, global health funding and support and action that we want to be able to make sure that that's harnessed as well to advance NCDs. So what is it?
Nothing.
Oh, it's kids outside.
Kids outside.
Sorry. We want to, it may just be a matter of extending the modeling to spotlight exactly those co-benefits on HIV and TB specifically, COVID as well. But it gets into, again, a discussion, more political discussion about what we want to spotlight, what we want to use our attention bandwidth for that we can generate in countries. And, first, why look at it? I think more and more the success of antiretroviral treatment and all the other advances in the HIV and TB support generally mean that the patients are growing older, the people are growing older, and the actual illnesses that put people in hospitals is increasingly non-communicable diseases. And here, this study already a few years old from WHO found that 57% of hospitalizations of people with HIV were for NCDs and mental health. So really, the more action we can do to reduce those, the better off the entire outcomes will be for HIV and TB. And a few years ago, did a quick review of research where we think it's most promising to find literature that we can use for the modeling. And there's plenty of options. And we looked at both the diseases, the behavioral risk factors, and the metabolic risk factors. And the green items are really where we can be confident that we can find literature to do this modeling. So the approach essentially the same as all the other investment cases, so we don't need to go too much in depth on it. Then the last point about health taxes as financing streams, we'll come back to that one. It's a really key difference here in a way to, catalyze some interest outside of our own world. I think what the sort of end result, the best end result we can get is action in countries by between us, Global Fund, and especially the country coordinated mechanisms defining the Global Fund grants in countries, and PEPFAR and the US government, what they fund in countries. Both in their strategic planning documents have sort of given a hint that they're open to addressing comorbidities, including risk factors, and even funding interventions that do them. There hasn't been a lot of action so far. There's been a lot of advocacy, especially at the global level, but we need to get the countries to know that they have these windows of funding opportunities available. And to do that, they need to be able to enunciate the business case for doing so, that if you act on NCD in mental health, you'll improve outcomes for the populations that they're being funded to improve. And a couple of little early successes, the task force, WHO and UNDP, have worked in Uganda to help them integrate NCD clinical interventions into their PEPFAR program with a budget initially of 1.5 million. And there's nothing unique to Uganda other than they've done it and had the success. But this is something that we think can and should be replicated far and wide in countries with high HIV and TB burdens. And again, the domestic resource mobilization is another key thing that we've got in our pockets that we can use to advocate for more attention on NCDs and mental health. Essentially, both Global Fund and PEPFAR are, a lot of countries are graduating out of eligibility to receive those funds, which are really significant, sometimes bigger than the entire health budget of the country. So as that happens, especially the development partners are looking for mechanisms for replacing those resources to ensure sustainability and continuation of services. Health taxes are a perfect vehicle for that. And this is a field chart just internally we've used to demonstrate that this is most of it's taken from a tobacco control investment case with some tobacco tax revenue modeling here. And you can see the yellow one is the indirect losses from tobacco. The out-of-pocket only health expenditures is the gray. The economic benefits that could come from this is a 5-year period, is the blue. And then the green part is the additional revenue that could be mobilized to fund the little orange and red parts, which are the costs. So you can see already the pool of resources we're looking at, additional new funds that could come in, peel off a slice of that, and you can cover everything we've wanted to cover for tobacco control and HIV and TB in the country. And again, you can't see it, but the red part in the bottom is the total footprint of Global Fund grants in that country, which is both the 3-year grant cycle total, plus the commitment of the country of domestic contributions to the Global Fund. All of that could easily be covered just by a modest earmarking or allocation of those additional health tax funds. So we think it's easy arguments to make in country that hit on a few key themes that have been popping up elsewhere. How to work on it? There's no project yet set to do it. It's not formal. It's going to take a group of interested and committed people to push it forward until it gets some momentum, I think. But it's worth mentioning that the task force have a working group on comorbidities that's been looking at how to position this work, how to advocate, how to bring more partners together to do so. Open door for anybody who wants to join that. I assume you don't need a UN grounds pass to be part of that. So I think anyone interested can contribute. And that brings us also to the broader discussion of the contributions of UN volunteers, which we've made massive use of in recent years. And I want to make sure that everyone knows how to access them, and everyone knows how to become one. There's a website, I think it's just onlinevolunteering.org. There's a UN agency that coordinates the work of UN volunteers who either sit in country and act as essentially UN staff to contribute to this, or who work remotely. And this is what we've primarily used lately, is you can put an opportunity on their website. Within a couple of days, you get hundreds of people applying and wanting to contribute. It takes some work to, select them, to brief them, to coordinate them, to make sure everyone's on track. But it's a massive resource that can get a lot of this work done. And we've got groups working on data collection. We've got groups working on building out new modeling. We've got groups working on desk reviews for the initial parts of ICAs. And I want to also just thank, because I know there's a lot of colleagues who are UN volunteers on the call now, and just thank everyone for the contributions you made. But all these new areas of work, I think really can be accelerated by getting a group of interested people who are often experts in either this field we're looking at or in other fields who want to try something new. And then again, specifically for the UNDP colleagues, the UNDP is a principal recipient for, I think, about 12 to 15% of the Global Fund's portfolio. And the country program management units have a lot of connections already that can be leveraged for this to get us into the discussions and planning with the country coordinating mechanisms to make sure that these have a chance of getting into the new grant proposals and or be considered for reprogramming during the grant cycle. So I think it's up to us to make the arguments concrete, and I think in each country we can make a strong case for doing it. So another one, again, could be separate comorbidities investment cases we're looking at, could be working this into existing NCD ones that we're doing already, or realistically it's going to be both. So that's all, and happy to take any questions anyone's got.